Hi, I'm Cindy Henry, and I'm the director and founder of LA Therapy Network. And I wanted to talk a little bit about the approach that we take to treating trauma. You hear, trauma is kind of like the big buzzword lately in therapeutic communities. Everybody's, I work with trauma, but there's not a lot of people who are really trained in a lot of different ways of working with trauma. And I think that's actually one of the things that's made it really successful in our approach to trauma, is that we have a more comprehensive approach in terms of working with the mind and the body, working with really trying to help people or help women. A lot of it is, we specialize in women's therapy, not that we don't work with other people, but our specialty and our expertise is really in helping women through different kinds of trauma that they may have experienced. There's some basic approaches to trauma that may be different depending on the severity of traumatic events that people have experienced. First is just let's say there's a one-time event. Usually that's not as difficult to treat. It's fairly simple and kind of straightforward. I always start with talk therapy. I always want to get to know somebody and get to know the way that they work, the way that they are able to maneuver in the world, and what kind of defenses they use and how trauma has affected them presently. And then I begin to work with the symptoms to give them skills, both physically and cognitively and emotionally, to be able to resolve some of the basics that come up with trauma that are shifted. One of the things that happens with trauma is trauma affects the body. A lot of times people think, oh, it's a psychological issue, so therefore I just need to kind of talk it through. And in some ways that's really helpful, and I do a lot of talking through with people. But it's also really important to engage your full mind and your body in all of the different ways in which you process and experience things. Trauma is a physiological response, and if you have been traumatized and it's developed into post-traumatic stress disorder, it's become something that is now caught in your body. And so with that, you need to be able to work it out by using skills in different ways, like doing some body work, doing some cognitive work, doing some emotional work, sensory work. And so our approach to working with trauma is actually fairly comprehensive. The thing that I have found the most helpful for most trauma is starting with talk, assessing and building skills, working to resolve the initial symptoms, the things that you first come in with that make it really difficult, the anxiety, the nightmares, the panic, the things in your body that you feel, the triggers, working with the kind of activating symptoms as well as dissociation, checking out, numbing, giving tools and skills to work with that. And in some of that, I may use different kind of physical interventions. I may use psychological ways of working with it, educating and working with the body in terms of emotion, and processing emotion in that way. Also using art, a lot of different kinds of creative therapy, some bibliotherapy, which is basically just recommending certain books that might be really good or helpful. But once you've kind of learned how to navigate trauma, then I usually want to delve into the depth of it to be able to really work it through. And again, some of that comes with body work. I personally am trained in sensory motor psychotherapy and EMDR, and I like to use a combination of those two along with talk therapy and art therapy, and a lot of different kinds of creative therapies along with it. Sometimes sand trait therapy. I find a combination approach is really helpful. But in addition, another component that is really important at that stage of treatment is group therapy. And a lot of people go, I don't want to go to group, which is really understandable. It's scary and hard to think about moving to that level. But what people usually find is if you're in a good group and it's really bonded, that that is an incredibly successful approach to working with trauma in conjunction with individual therapy that is involving body work and talk therapy. So it's usually a combination based on whatever is presenting at the time. And then, of course, at the end, as your symptoms are resolving, kind of, bringing a kind of a what kind of meaning does this bring to my life now? How have I learned and grown? Kind of transitioning from the intensive therapy work to back to regular supportive therapy, and then helping somebody to move out of therapy. And a lot of people have said, well, therapists just like to keep us in therapy. That's not true. At least not in my case. If it is time and if you're done with your work, I'm going to kick you out. And one of the things that I really want to mention here that's important, and this is, again, treating trauma from the post-traumatic stress disorder element. There's deeper levels of trauma that are complex trauma that have to do more where you've developed a dissociative disorder, and that treatment's a little bit different. I'll talk about that in a different video. Lost my train of thought. Okay, I lost that one. Forget. With one of the things with trauma that is really important, and that is always really discouraging and disheartening to me, is that we start to resolve symptoms, or we start to get into things that are more difficult, and people terminate prematurely. And when they do that, it locks the trauma in for longer, and it makes it harder. A couple of things that are important to mention. I have a motto that slower is faster. A lot of times when you are in the midst of dealing with PTSD, you want to get through the pain and you want to get through it quickly. But in reality, that's not effective. In fact, it works the opposite. It makes you scared and run, and then you take longer before you come back to start to work on it again. So a slow, kind of steady pace where you work on things, you work on skills, then you kind of breathe, then you're trying to live life, and then you dig in again. That seems to be the most effective approach. So I hope that's been informative for you, and if there's any questions or you are interested in doing some trauma therapy, please do give me a call. Our focus is a lot on women and trauma, and also children and trauma. We do work with men as well, but our specialties are definitely working with women and adolescents and children. So please, do give us a call over here at LA Therapy Network, and we look forward to talking to you soon. You can find us at www.latherapynetwork.com. Thanks.